Neck surgery rates have tripled over the last 20 years. And a lot of that has to do with our access to imaging. Because as soon as you go to a doctor's office, they're gonna take images, they're gonna take x-rays, and they might lead up to an MRI. And as soon as a surgeon sees that there's a structural problem with a disc or degenerative disc disease or arthritis just right there in the neck, then they're gonna have something to do surgery on. So in this video, we're gonna talk about essential exercises and give you the blueprint in just 10 minutes a day that'll help you with your neck pain. Let's get out of it and then keep you out of the surgeon's office as well. Let's get right into the exercises. Okay, the first of our 5 essential exercises is structured around thoracic mobility. So we're gonna take a towel roll, we call it Texas towel roll. We roll up a towel and we're gonna lay down on it. And so I gotta work on this mobility. This is an exercise, a lot of our clients love it. So I'm gonna keep my knees bent, I'm gonna tuck my chin, and then I'm gonna put my hands right here on my chest, or I can put them out to the side, I can put them up over my head, but I'm just gonna breathe and relax. I'm just under my shoulder blades, and I'm gonna sink down into that towel roll, taking 5 breaths. Just really focus on relaxing when we do this. I'm gonna shimmy my body down a little less than an inch. Chin tuck, knees stay bent. 5 breaths again, and then I'm gonna go to my third spot, just right mid shoulder blade to top of the shoulder blade. So I start under at the base and then about mid shoulder blade, maybe a little bit higher. And I just breathe and relax. I'm sinking down into it. And that's our first exercise. So first we gotta loosen things up. Number 2, we call them pistols. So we're gonna lay down long ways right here, and I need to get into the rib cage and those muscles in between the shoulder blade and the spine. And so I'm gonna make a pistol right here, and I'm looking down the sights of the gun. So my knees, my belt buckle, my hips, my arms are all gonna rotate to about 15 degrees. I'm just gliding into the towel. I don't want to go too far. I just fall right off of the towel roll. So I'm going right here. I'm rolling into it. Now, can you do this with a double lacrosse balls? Yes. But is it too aggressive? Yes. So we want to make sure that we're easing our way into this stuff, increasing mobility so that we move more through the thoracic spine and rib cage and less through the neck. This is a linchpin in getting long-term improvement with your neck. We're going to do 10 little rotations, and then we're just going to switch sides and do 10 rotations. So with this one, I don't feel it as much, so I'm gonna get over a little bit closer to my spine right here, and then I'm rolling into it. I'm keeping my chin tucked, and I'm looking down the sights of that gun where my whole body goes together, keeping the pressure right there. I'm just gonna do 10 on each side. Now we gotta start sparking up some of these muscles. So let's go to number 3. Number 3 is scap squeezes. So I'm gonna be pulling my shoulder blades together, squeezing them down and back, down and together like this. So my chest opens up, I maintain my chin tuck. You do not have to do these on the ground in this position. You could do it on half kneeling, you could sit on something. I want you to get a good view of what my shoulder blades are doing right here. So I'm maintaining that chin tuck, and I'm squeezing my shoulder blades down and back. Making sure that I'm pinching shoulder blades, opening up the chest, and I'm gonna do 20 total reps. So I do 2 sets of 10, keeping that tension in the band. Now, number 4, we're doing an exercise called Batman's, because Batman doesn't fly like this. He flies with his arms down, potentially. But I don't think he flies, honestly. I don't think he has superpowers. Batman's are about externally rotating. So we're getting our shoulder blades to dig down and back. You could do them on the ground. I would suggest putting some pillows underneath your chest so that your face isn't right down into the ground. But you can do it on a bench at the gym. Right here, I'm just gonna do it right here on this bench. It's a step up, but it's the same thing. So I lay down on my belly right here. And so now I'm maintaining my chin tuck. I tuck my belly, and then I turn my thumbs up and my palms out. And then I don't want my elbow to go past my rib cage. That's gonna tilt my shoulder down. What I want to do is make my elbows stay at my rib cage and make my shoulder blades lead the motion. So I'm squeezing my shoulder blades down and back, and I'm holding that for 30 seconds. So I'm driving this angle down and back. I'm bringing those shoulder blades together, and I'm squeezing them, and I'm keeping my palms facing out and my thumbs up, maintaining that position with the chin tucked, belly tucked. I want to tuck my belly because I don't want to go into back extension. I'm maintaining that. I rest for 10 seconds, and then I go right into going back into the exercise, maintaining, squeezing the shoulder blades down and back together, holding that for 30 seconds. And we're just going to do 2 repetitions of that, making sure that we're firing up all the muscles in between our shoulder blade. Remember that we're getting mobility through the thoracic spine, our rib cage, and then we're firing up the muscles in between our shoulder blades, because a lot of our shoulder blade muscles come up and attach to our neck, cause us these problems, especially the upper trap. You know, a lot of people deal with upper trap pain. It's pulling on our neck and on our head. We're gonna get better balance in those shoulder blades. Make sure you hit the subscribe button so you don't miss out on any of this content. We're gonna make sure that we're posting exactly what you comment. Let us know what you need, and let us know if anything's not clear, because the things that we do here are the things that get us 94% success with all of our clients that walk through those doors. Number 5 is threading the needle. And this is essential. We've got to lengthen out those muscles, but we don't want to do neck stretches, isolated neck stretches. That'll make you feel better for 2 or 3 minutes, and then you feel worse again. We want to stretch chains of tissue. So what I'm going to do is I'm going to stretch this entire chain coming across with my head slightly down, and I'm getting through my lat, my shoulders, my upper trap, my lower trap, and I'm gliding over. I'm gonna do that on the ground. So I'm coming right here. I'm gonna push my arm over to the side, palm up. I'm gonna put my right palm on top of it, and I'm just gonna barely allow my head to touch the ground right here. And then I'm just rotating, I'm pushing myself over. Now, each time I do that, I'm taking a breath and I'm sinking deeper into the stretch, and I'm feeling it all the way down to my pelvis. I'm gonna set up on the other side and put my palm down, and then I allow my head to dip down and I push over to the side, breathing out. I'm not putting much pressure into my head at all. Very little, 1% pressure, just so my head goes with me, and I'm pulling all those muscles in between the shoulder blades, so I'm lengthening out. So first thing I did was work on mobility through the thoracic spine, and then I got the muscles fired up in between the shoulder blades, and then I lengthened out all that tissue. Do this daily, and it's gonna be a daily practice that's gonna replace your daily pain. We'll see you in the next video.